The bulk of the people will have less symptoms or no symptoms, and the others who are those who have got no symptoms and those who have symptoms do shed the virus during that period. And when they do, the body works on the virus and sheds it until the virus is completely reduced from the body. The average is that it takes up to about 14 days for that to happen. So what we have agreed, and this is the international norm, is that generally when someone has got the symptoms and diagnosed positive, 14 days later, they should have, by and large, shed the virus off. And so many of them will be found to be negative at that point. But it is possible that there will be those who will not be negative at that point. They will still remain positive. But the researchers have confirmed to us that even if people are positive at that point, the level of infectivity is so negligible that they are unlikely to transmit the virus to the next people. And so we feel comfortable that if anybody was given 14 days at home and then they still had the persistence of the test, they are not as dangerous or as infectious as they would have been were they for the earlier part of their admission to the hospital. So I would say, because of that, we do not feel that it's necessary to repeat the test once you've finished 14 days, because the test can be positive or negative, but we think that the clinical impact of that, if the individual is well and the individual has got no symptoms, then they shouldn't be really causing too much of exposure to other people. So that's the way we're approaching it. And that is the basis of which we would discharge anyone as being recovered. It takes us to the next question, although I think the question that's being asked is a bit different. The question is, if someone has been admitted and 2 days later they are positive but they are feeling healthy, they are happy to go home, but they can't self-isolate at home, they would still be at risk of causing infection to others for another so many days until the end of 14 days. So we will insist that those people, if you can't isolate at home, then you must go and isolate in the hospital. That's why you go to the field hospital. It is compulsory to be self-isolated. The only question is the doctor can evaluate whether your living conditions allow you to be isolated at home, or it actually means they must recommend that you stay longer in the hospital. Isolation is recommended, and we would like people to cooperate with it. But if you don't cooperate, it then gets enforced. So that you must understand. The only difference is whether the clinicians are satisfied that isolation can successfully take place at home without the risk of infecting others, or it's better to actually get someone to be treated in the hospital. Then supermarket. No, that's going to be answered by MEC.
And trends.
Then, okay. Yeah, and then cell phone. Well, we haven't really started using much of that tracking aspect. We're using it for other things, just to record the presence of where the people that were screening are, where we're finding people to be referred. We're using it at that. We haven't really gone that far to be able to start tracing, to use all the tracking. We'd love to use it, but we're not completely at that level yet. But we're really working towards that as well. The issue of supermarkets, MEC will be able to give us that answer. Just to say, for the other provinces, we haven't really seen it, but she can talk about it in this area. I'm going to move so you can come and sit. Thank you.
That should have been the Premier answer. But I think the Minister has already responded to such that in the Western Cape, we have seen as many clusters compared to the other provinces. But in our response, because it's not only about following the case in regard to the tracing the contacts, but also it's about coming up with the measures like the guidelines that the Health Department together with the Department of Economy and also other departments in the province to come up with the guidelines and also in terms of sector per sector. So we've already been there. We have published those guidelines for each different sector so that you can know that if you are working in the environment like a post office, what is your responsibility as an employer and also as an employee? Supermarket, what is the responsibility of a shop owner and also of the shop user, what we call supermarket etiquette. So we have been there around that. I think what is crucial is about, whilst might have about 500 of the positive essential workers, because noting these are essential workers, most of them, whilst we have those, we have to follow them back home, and most of them, they might not necessarily be working where they are residing. So that's why you'll find the issue that the Minister was talking about, the mention about like in the metro, you've got 8 sub-districts. So there might be the workplace might be here in town, which is the Western District, but the person stays maybe in Hout Bay, which is the Southern District. So meaning you will have to follow some of the 5 of the cases might be in the Hout Bay, but the other workers, they might be in Khayelitsha, or the other workers might be in the Eastern. So that's why you'll find in all of the 8 metro districts, we do have a high level of local transmission. But as we have indicated, that we have worked across. Same applies. I know the Premier is going to Witzenberg, one of the high areas with a high local transmission in the rural district, where already we have come up and developed a plan that can speak to what the Minister has indicated about hotspots and using the whole of government strategy. I think the Premier probably should speak around that. It talks also about what the Minister has indicated in the metro, because he indicated that all metros, they've got a high level of the local transmission. The question is, what are the plans for the metro, zooming specifics in those hotspot areas, and also to have some of the implementation of the strict restrictions, but you cannot be only health alone. It should also be other departments, the law enforcement officers, and all of those. I think Premier probably should just talk about the Witzenberg and the whole of the government in that space.
Thank you, Minister. So with regards to, last week we had the hotspot identified as Witzenberg, and we've got 8 hotspots here in the city. And so we developed those plans, which is a whole of government plan. How does traffic and SAPs and policing get involved in making sure that we get behavioral change, that we close down and lock down? Or, for example, how do we make sure that the economy is involved, and you meet with the businesses and make sure they've got the right protocols in place, specifically a place like Witzenberg? Have you got social distancing even in your factory or your processing and workspaces? How do we deal with businesses when people come to when people come to town to come and do their shopping? Suggestions of how we can even get businesses to stagger paydays, so you don't actually all get your salary on a Friday. You can actually start staggering different parts of the town or the region, so people actually get their money at different times, so that you can actually start reducing congestion in town, because it's about getting the sort of congestion down, the social distancing in place, because if we follow those golden rules, we actually keep that curve lower. And we're doing it so now it's not only in Witzenberg, it is also in our other hotspots, and that's what we were talking about today with the Minister. Which are those hotspots in the city, Khayelitsha, the Tygerberg region, Dunoon, and then what are we doing around getting the whole of government approach again, making sure we've got the social distancing, we're meeting with the businesses, we've got law enforcement involved, we're community and down to ward level, we're community leaders, just like Minister Mbombo's been in the last week. You go and meet with the community leaders, you start to try to get much better behavioral change, because it's about government and citizens working together so that we keep the curve from exploding, which is happening in these hotspots, slowing it down as much as we can.
Minister, could you just please clarify the total number of deaths as well as the total recovery?
Deaths and recovery.
Oh, I see. Sorry.
The question?
Oh, okay. Is there another question? There's another hand.
Minister, are you concerned the Correctional Services Department announced over the next 10 weeks they're going to put their parole system in place and then start releasing around 19,000 inmates? In 10 weeks, that's slap bang in our peak here in the Western Cape. You mentioned the peak being around end of July. Are you concerned that inmates will be moving from a low-risk situation to a high-risk situation? And then my second question, in the hotspots, will there be reinforcement of police and soldiers and the necessaries in these hotspot areas?
Okay. Are there more questions?
Yeah.
I have one question for the Premier. There's been a call for these hotspots in the Western Cape to be placed under level 5 lockdown restrictions again. Is that a consideration at this point, or is there any comment from the Western Cape government again those calls at this point?
Ministers, could you advise on what the net death rate looks like? In other words, has the net death rate in South Africa gone up? And if so, by how much or how little as compared with the annual averages?
Okay. Let's just let me just deal with the first issue.
The deaths?
Yes, the deaths. All right. Let's start by saying that we have 9,420 new cases, new positive cases. That is 525 new positive cases in the last 24 hours. We've got 185 deaths, and we've got 3,983 recoveries. So that is where we stand. Now, we normally talk about the total deaths and recoveries as resolved cases. So that is a lot. So the only people who are likely to spread the infection are those who are not in these two categories. Those are the ones we consider to be active cases. So I can just leave it at that. And then the average mortality rate is just under 2% in the country, and that is not that is in keeping with the trends, the global trends. But of course, there are many countries that have much worse than that. So in our case, we have that as our numbers, and that we think is within the norm, and we use it interchangeably. Sometimes if we look at the figures, we sometimes take the figures and then use that norm and try and estimate how far away from the total number of possible positive cases are we, and we use it for forecasting. So it's still within an acceptable range in terms of what we're talking about. Then the other question relates to the prisons. Look, I think what we need to do from the point of view of dealing with COVID-19, we need to adjust to the fact that it's a change of behavior that's going to be important. The change of behavior will mean that we need each one of us to know that we have to focus on proper hygiene, coughing and sneezing hygiene, hand sanitizers, using masks, and keeping a distance. That is where the risk is reduced for the infection. Whether you've got more people who come from prison or not, if everyone focuses on that, that won't affect us. So what is important is for people to also move away from stigma. Everybody will have this infection if they're exposed. And so we mustn't start making too much of a label onto any part of the society because of the risk of exposure. I think it's important to say that all of us are at risk, all of us can take action, and all of us can save the nation from the infection. Thank you.
The restrictions.
What restrictions?
Repeat your question.
It calls for the level 5 restrictions to be implemented again in the western part.
Oh, you wanted to know whether the other department will be involved.
No.
No, there have been calls for hotspots that not.
Oh, that's for the premium. No. When you ask that question, I'm here from not the premium.
Sorry, Minister, could I just ask a point of clarity on the Minister's response?
Okay. Because I'm looking at both, also the Minister has to leave, so it's Mr. Williams, and then the Premier respond to that, and then I think after that the Premier, then you can just maybe close.
Okay. Ma'am, I was asking about South Africa's net death rate. My understanding is that every year,
I see.
How many people die normally during a month?
Yes.
What is the current death rate in relation to the normal average?
Look, I don't have the figures, but I can tell you this. For the past 5 weeks, the death rate has kind of decreased. And the decrease has been mainly attributed to the reduction in unnatural causes. The motor vehicle accidents, the gunshot wounds, the gang violence, the stab wounds, all of which are linked to interpersonal violence. The interpersonal violence which are linked to the consumption of alcohol. I don't have the figures here, but we've actually got a demonstrable pattern that's showing us that we have actually have a large number of deaths that have actually been avoided in the past few weeks. So from that point of view, the past few weeks have actually reduced the numbers of deaths. And that also goes with the pressure in the casualties, in the theaters, in the orthopedic the departments, etc.
And in relation to normal comorbidities? In other words, if 100 people normally died of heart attacks or various things, what is that number now, if you take out the interpersonal violence?
Well, we'll have to get that analyzed. But at the moment, as we speak, all we can say is that those morbidities that are associated with COVID-19 have been largely associated with comorbidities of heart to cardiovascular diseases, pulmonary diseases, cancers, and diabetes, and those are largely the issues that are associated. We haven't got any other study that shows any other pattern at the moment. Thank you.
Thank you, Minister. Thank you very much. So that question on level 5, no, there's no discussion of going to level 5, although I have heard certain people calling for it. Obviously, it is a tool and a lever that you can use, but our discussion was, how do we have a look at those hotspots? And so what we're doing is focusing on the hotspots and management tools around the hotspots, because, of course, there's lots of or many municipalities in our province, and in actual fact the number of infections are reducing, and quite a few of them who've had a stagnant number for more than 14 days, so they're almost going down to naught again. So it really is not about going to level 5, it's about dealing with the hotspots where it is growing fast. And in actual fact, I think we've got to talk later about how do we actually enable more of the economy in some of those other places sooner.
In close. You are closing.
And then I'm closing. All right, once again, thank you very much. Can I say, Minister, thank you very much for spending the amount of time you have with us. I must also use this opportunity to thank those health professionals who came and gave their reports. It is always good to know that you have this solid base of really good professionals. So Dr. Kluti, you, your team, and all those professionals that you pulled in, thank you very much, because it helps the minister also feel a bit more confident when you see these numbers and you need to come and see exactly what is happening. And as he said, you can see that from that aspect we've got a good team. Of course, it's about managing the hotspots, and that was a lot of the discussion, understanding some of the risks and shortfalls, and we've addressed those, and there's some of those areas that we will take forward. So it's these kind of meetings that are really crucial. So once again, Minister, thank you very much. We've got many, many frontline staff who go above and beyond, and we're really proud of them. We know that they are nervous because they are in the front line, and I think the Minister spent quite a lot of time recognising them. And I want to just end off with saying as well, from my side, I thank them. Anybody in the front line while fighting this virus, we really, really do appreciate everything that you're doing, and we will play our part in making sure that whatever you need to be protected, whether you need to get those tests faster, whether you need more PPE, you can see our stocks building, we are there to look after you as well. So thank you very much.
Thank you.
Thank you.
Thank you.
Can you see on the dashboard, it still only has yesterday.
All right, that's the Premier of the Western Cape, Alan Winde, alongside MEC of Health in the Western Cape, Noma French Mbobo. Of course, they're hosting the Minister of Health, Zweli Mkhize. They were leading those presentations on the Western Cape's province's response to COVID-19. You would have heard the Minister saying that the confirmed COVID-19 cases in South Africa now standing at 9,420, and you'll remember a while ago we didn't think that we'd reach those kind of numbers that we had been seeing in other countries, but indeed here we are then at this point. And of course the Minister taking us through the areas of concern that made the Minister specifically come to the Western Cape this weekend. The rapid increase of numbers in the province and concerns raised there about what needs to be done. Do stay with us here on SA Today as we continue with our coverage of COVID-19.